into all that stuff. But if they had the ultimate mental status, wouldn't you already determine if it's off?
Yeah, you determine if they have an altered mental status when you determined APU and GCS.
Right. So I'm saying, is the assessment different when you go all the way through it, rather than getting all the way to the end and saying they have an altered mental status because lack of glucose or whatever it is.
So yeah, all you need to remember is if they have an altered mental status, you'll figure that out like you said in APU, GCS, you'll figure that out, and then you'll go through your altered mental status question set, and you keep going through.
Okay.
You keep asking this. If they can't answer your questions, who could you ask? A family member, and then direct the same patient assessment to the family member, and then once you go through that, you do your modified secondary, you do your baseline vitals, then in interventions you just go through the.
Okay.
Does that make sense? Did I answer your question?
Yeah, no, you definitely did.
Good.
A lot.
I know. So, any other questions? Okay. So what I'm going to do is go ahead and demonstrate for you guys. Would you guys like me to demonstrate how we want you to see it? Yeah. Okay, good. I know. I'll be right there. Chest pain. All right. So I'm going to do it just like how you're going to. Grab this stuff.
You did chest pain last time you demonstrated this?
What's that?
You did
You
chest
want me
pain?
to do something else?
Yeah, just do abdominal pain class or something like that.
So I'm going to come in. I'm going to walk in. This is when I'm going to come in. Chris here is my proctor. I have my blood pressure cuff. Actually, you don't need your steth.
Now I'm trying something else's blood pressure cuff.
Oh, I'm not going to use it. I'm just demonstrating. So I got my blood pressure cuff, got my eye pen. I'll have a pen with me. I'll come up, give them the form.
All right, today, nervous? Shitting bricks yet?
Yeah. I'm so nervous right now. All right. Give them the form, and then, okay, I'm ready when you're ready, sir.
All right, you're dispatched to the scene of a 24-year-old male complaining of abdominal pain.
24-year-old male complaining of abdominal pain. Okay. So I'm going to go ahead. First thing I'm going to do is BSI, scene safety, looking at nature of illness, mechanism of injury. Is it safe to say this is the nature of illness?
Yes.
Okay, great. I have one patient. I'm going to consider additional resources and consider C-spine. I'll rule it out later when I get there. General impression, I got a 24-year-old male sitting in his chair. Looks like he's grabbing his chest right there. At this time, he looks stable. I'll just keep going with my assessment, determine my chief complaint. Good afternoon, sir. My name is Mike. I'm ENT. Why did you call 911 today?
Because I'm having really bad abdominal pain.
You're having really bad abdominal pain? Okay, chief complaint is abdominal pain. What's your name, sir?
Chris?
Chris. Now, Chris, where are you?
We're at my house.
You're at your house? All these people. What year is it?
2011.
2011. Now, Chris, with your right hand, can you raise it up and give me 2 fingers? Perfect. I know my person's alert and oriented times 3 to person, place, and time. GCS, eyes are 4, verbal is 5, motor is 6 for a total of 15. Go ahead and assess airway. He was answering all my questions in complete sentences, so I know he has a patent airway. I was assessing his breathing. It appears to be good tidal volume, adequate. Is that safe to assume that?
Mm-hmm.
Great. Since it is abdominal pain, I'm just going to go ahead and get my partner to hook up the non-rebreather, put up to 15 liters. Great, I have this. All right, so I'm going to give you some oxygen through this mask. Go ahead and breathe normally. Put it on his face. Perfect. Go ahead and reassess breathing. Is he still breathing at good tidal volume? Adequate? Great. Since I'm up here, just do a quick blood sweep. Do I see any bleeding?
Nope.
Perfect. Go ahead and assess pulse. Pulse is as I feel it, strong and regular. Skin sign. Sorry, my hand's a little cold. Pink, warm, and dry. Since I don't know what's going on with the patient, he is complaining of abdominal pain, I'm going to just move this along and make him a priority patient, and we'll go in the back of the ambulance and continue the rest of the assessment. I'll go ahead to my modified secondary OPQRSTI question set. Now, sir, did this pain come on fast or slow?
Pretty gradual and slow.
Pretty slow, pretty gradual. Okay. Does anything make your pain feel better?
Not really. I mean, it's been kind of achy since I've woken up this morning.
Real, okay, just achy. Does anything make your pain worse?
Not that I can think of, no.
Not that you can can think of. Okay. And then can you describe this pain you're having today?
It's just like a dull, really achy pain, just like
Dull.
right here, yeah.
Right there? Okay. Now does that dull, achy pain, does it go anywhere else?
No, it's just right here.
It's just right there?
Yeah.
Okay. Now on a 1 to 10 scale, 10 being the worst pain and 1 being the least, how do you rate your pain today?
I'd say it's like a 7.
It's like a 7? Okay. And how long has this dull, achy pain been going on for?
Since I woke up,
Since you woke up? So roughly like how many hours?
like 8 hours.
8 hours? Okay. And have you done anything for this pain today?
Yeah, I tried to take some ibuprofen.
And did that help when you took it?
No.
And how long ago did you take the ibuprofen?
About 4 hours ago.
About 4 hours ago. Okay. Now, sir, do you have any allergies to any medication?
No.
No. Are you on any medication?
No.
No medication. Okay. Have you any past medical history that pertains to this dull, achy pain? Has this happened to you before?
Back in my frat days, like, okay, you see this pain.
This pain?
Yeah.
Okay. And did you get it checked out or nothing?
No.
Did it just stay there for a while? Did it, go away in a couple days or?
Yeah, but it's really bad this time.
It's really, really bad this time? Okay. What's the last thing you ate today?
I didn't eat anything.
Didn't eat?
Feeling like crap all day.
Okay. Have you drank anything today?
Just a little bit of water.
Just a little bit of water? Okay. And what were you doing before this pain came on?
I was just sleeping in. Got back from Vegas last night.
Nice. All right, okay. Now, did you happen to fall, hit your head, anything like that?
No.
No, okay. So at this time, we'll go ahead and rule out trauma, and rule out C-spine precautions. Move into my modified secondary. First thing is, I'm going to use my IPA. I'm going to go inspect. I'm going to lift up the shirt, just verbalize it. I'm inspecting for any like pulsating masses, scars, bruising. Do I see anything like that?
No.
Nothing like that. Okay, go ahead to palpate. Now, can you go ahead, sorry, point one more time where the pain is? It's right there.
Right there.
So I'm going to push on your abdomen. Let me know if anything hurts, okay? Does that hurt?
No.
No? What about that?
No.
No? What about that?
Well, not that much. Oh, yeah, that hurts.
That hurts right there? Okay. And since I'm up here, put my ears in, I'm just going to verbalize this. I'm going to also take lung sounds here, 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 and here. Can you lean forward for me? Right there, and right there. Go ahead and come back. How are the lung sounds?
Clear bilateral.
Awesome. All right, so once I do that, then I'm going to go ahead, at this time, obtain my baseline vitals. So I'll go ahead and get the sheet from my proctor. I'm going to go ahead and fill out my respirations, my pulse, blood pressure. I'll do auscultated and palpated. Skin signs, already figured that out in my circulation. I'll fill that out. Sir, can I see your finger? Right there. Switch your forearm. Perfect. Do cap refill, pupils. And then LOC and glass codes, great, I already know it, AO times 3, glass code, eyes, his eyes are open spontaneously, so he gets a 4. Verbal, he answered all my questions, so he's oriented, so he gets a 5. Motor, he followed commands, so he gets a 6 for a total of 15. Alright, I'm done with my vitals now. There you go. Go ahead and continue with my assessment, move into my interventions. Now, due to the standing orders, I can't do anything or give you anything for your abdominal pain today except for the oxygen that I'm giving you. And then go ahead and from there I'll move into my, reassess my transport decision. I already determined this is a priority patient, so we're already transported to the hospital. Then I go ahead and go to my reassessment. I'm going to just verbalize, reassess my primary, which is ABC, GCS, LOC, then reassess my modified secondary, reassess vitals for you. I'll just do it since you're stable every 15 minutes, and then reassess interventions. Now, again, on a 1 to 10 scale, 10 being the worst pain, 1 being the least, how do you rate your pain now?
7.
7, okay. And that's the end of my assessment.
Thank you.